So TIBU is an electronic platform that we use to register TB patients and collect data from within our health facilities that are treating patients. So we auto-populate all the facilities, but the data is specific for all those facilities that are managing TB patients. So TIBU as a platform has helped us to do a real-time data as opposed to the other times when you are able to, when you are doing the manual tallying. Manual tallying is prone to so many errors, but the electronic one is quite fast because you are able to see data on real time. Two, it is also able to remind us when we need to do follow-up for patients. It prompts us occasionally to show us how many patients we have not done sputum follow-up. So those patients who will do their smear at the end of 2 months and their sputum does not have bacteria, then we presume they are improving and they are okay. They can continue with their treatment. However, for patients who will have smear at 2 months having bacteria, then we usually do an extra investigation called gene expert or culture, so that we can be able to see whether the patient is developing drug resistance. We are also able to request for supervision, facilitation for us. We are also able to request for payment within a very short time for the patients who are being treated or managed for drug-resistant TB. So in short, it is a system that is able to help us to do our work with ease. Even also in terms of tracing the defaulters, because we are able to auto-populate and see how many patients we have within a specific location and how many have either defaulted or are continuing, and we can be able to do a quick intervention like screening in cases where we have so many patients coming from a specific locality. Defaulters usually are people who have run away from treatment or have decided on their own reasons not to continue taking drugs, either because of issues of distance, cost, or side effects from the drugs. We may never know. But these patients who we call defaulters, patients who have run away from treatment, are a major problem to us because they are the ones who are coming lately with drug-resistant TB types. In normal circumstances, it is cheaper to treat a normal TB because it takes 6 months. But it is very costly for us as a country and as government to treat drug-resistant TB cases because it's quite tedious. It takes a long duration of time. It takes away the privileges of the patient because the patient has to be observed on a daily routine by a healthcare worker. And it also, in terms of cost that the government spends either to facilitate the patient to come for treatment or to buy the medication or foodstuffs for them, is quite huge and deprives maybe the other health sector money to utilize in other areas. So we feel it is our mandate to ensure that every patient who we start on treatment should ideally complete treatment. And maybe in the near future we are looking into maybe enhancing the Public Health Act, not to override the human rights, so that those patients who refuse to take drugs for their own reasons can be isolated somewhere so that they can complete their treatment to avoid developing drug resistance, because drug resistance is a man-made problem.